Good evening, colleagues. I'm Dr. David Mkwanazi, an occupational medical practitioner, economic risk assessor, exposure scientist, and health professions educator. But most importantly, I'm a colleague of yours. Professionally, I'm an OMP at VKB Group, University of Johannesburg, Oconbrick, Hard Atlas Packaging and Life Health Solutions, as well as Adco Blue. As always, my role today is to represent the Occupational Health and Exposure Sciences Academy as it aims to save workers, empower employers by enriching occupational health professionals with knowledge. Today's session is proudly brought to you by Occupational Health and Exposure Sciences Academy in partnership with corporate and industrial medical consultants. To make sure that things run as smoothly as we expect them to, kindly please allow me to go through a few house rules. This session is accredited for one general CPD point by HPCSA and for South African Nursing Council registered participants. South African Nursing Council attendees should contact Lebohang to guide them on how to upload their points. The CPD point will be allocated to colleagues who have paid a registration fee, and colleagues still have the opportunity to finalize that with Lebohang before we submit to the HPCSA and the Nursing Council. Colleagues who do not wish to receive CPD points are welcome to attend this session for free to enrich their knowledge. Kindly please drop your HPCSA number, full names, and email address in the chat box to register for CPDs. For those who are not registered with HPCSA and South African Nursing Council, an attendance certificate will be issued to demonstrate your growing knowledge capacity in areas covered by our platform. Please keep yourself muted at all times to avoid interrupting the presenters. Disruptive attendees will be removed from the webinar and will not be able to join again. This session's attendance will be monitored for its entire duration to ensure full attendance. Kindly please ensure that you do not join using nicknames or handset device names to be properly identified and allocated your points. Each session will be podcasted on YouTube for long-term education and training purposes. We have realized that many colleagues go back to our YouTube page to recap on the information that may have been missed during our sessions. We also urge you to post your questions on the video platform to continue empowering yourselves and colleagues who will always be able to access our learning material. The link that you have used today in this session is a recurring link and can be used every month on the last Thursday of the month until the end of the year. Participants will be allowed to ask questions or comment after each session. Questions can be posted in the chat box anytime during or after the presentation. Our sessions are multidisciplinary in nature and are meant to empower colleagues from different professional backgrounds. Kindly please be patient during moments when we discuss topics that may not be relevant to you, but others. Today we celebrate our 2-year anniversary webinar session and promise many more to come for the rest of the year and going forward. Amongst us today, we have colleagues who are generous enough to introduce us to the world. Colleagues, please mute yourself. Amongst us today, we have colleagues who are generous enough to introduce us to the world of occupational health and safety in mining, the world that most of us have never had the privilege to experience. Well, Today is the day and all our questions will be answered. Late last month, we presented a 4-day course on managing ergonomics in the workplace with a practical session on ergonomic risk assessment on the last day. Kindly please contact Lebohang if you would like to arrange for this important training for your workplace or yourself. Lebohang's numbers are in the chat box. On the 28th of February, we will host a new refresher webinar for 3 hours on executive medicals, accredited for 3 CPD points at the cost of 250 rands. Colleagues may still attend for free without CPD points if they are just looking to gain knowledge on the subject matter. Details and registration information will be available from Lebohang. That's in 2 days' time, colleagues. On the 14th of March, we will host the next refresher session on managing work-related upper limb disorders in the workplace, and this session will be at no cost to you. The details are shared in the training schedule that we have shared in the groups. On the 26th of March, we will host our monthly webinar on audiometry in the workplace. The cost to attend will be 50 rands and 1 CPD point will be available for colleagues who have paid, with all the other colleagues being allowed to join at no cost if they are just interested in gaining knowledge. On the 28th of March, we will host a new refresher webinar for 3 hours on ergonomic medical surveillance, also accredited for 3 CPD points at the same cost of 250 bucks. Colleagues may still attend for free without CPD points as usual. Details and registration information will be available from Lebohang. Lebohang's WhatsApp number is 064 520 3301 and the email is ohesa.dlp for digital learning platform @gmail.com or hesa.dlp@gmail.com. Lastly, colleagues, we have big and exciting plans for our platform and have decided to charge a small fee, as you may have noticed, for our monthly webinars in order to be financially sustainable and be able to attract top quality speakers like the ones we have today. We acknowledge that the platform has grown and needs to adapt to the demand from colleagues and not limit attendance to 100 participants anymore. So going forward, as many colleagues as possible will be able to join without being locked out of the webinar after a certain number has been reached. Colleagues, we count on your loyalty and support to help our platform grow and continue to empower us. In 2001, edited by Dr. R. Guild, Professor R.I. Ehrlich, Dr. J.R. Johnston, and Professor M.H. Ross, the Safety in Mines Research Advisory Committee, also known as SIMREC in short, published what would be known as one of the most detailed and resourceful manual on occupational health in mining in South Africa, titled Occupational Health Practice in the South African Mining Industry. This book continues to guide professionals on various aspects of health and safety in the mining industry. We are grateful for the continuing support and stewardship from the Mine Health and Safety Council and Department of Mineral and Petroleum Resources in the crucial role they play in keeping the South African mine workers healthy and safe. Please join us today, colleagues, as we explore this industry that makes our country unique amongst other global role players. Welcome to the Occupational Health and Exposure Sciences Academy, and thank you for honoring us with your attendance this evening. In today's session, we will have two sessions. The first session will be on introduction to occupational health and safety in mining. Following that, we will, depending on time, we will have a brief session for questions before we delve into introduction to occupational health or occupational medicine in mining, followed by a short period of questions also. On that note, colleagues, please allow me to welcome Mr. Elomonaring, who is currently a SHE, that is Safety, Health and Environmental Manager at Purple Rain Mining and Ocon Bricks here in Vereeniging and Meyerton. She is currently the SHE manager and previously has worked in different roles in health and safety for different companies, including Lanseria International Airport, Department of Health in Gauteng, Port Health Division, Johnson Control, Alex Ginten and Associates, Afrox, Eskom Holding, Samanco, and Rheinmetall Defense. Ms. Monaring has a BTech degree in environmental health. She has a certificate in enterprise risk management. She has management development program. She has completed management development program from Stellenbosch Business School, among many qualifications that she holds. Please allow us to welcome her colleagues. Austalo, are you here?
Yes, Doctor, I'm here.
All
Thank
right.
you.
I think you have asked me to share from my side. So
Um,
please allow me to share.
okay.
All right, just a second. Okay, I'm just sharing your slides. Please let me know once you see them.
Yes. Can you just put it in a presentation mode, please, Doctor?
Okay, means I shared the wrong. Is it better now?
Yes, it is.
All right.
Thank you.
All right, Ostalo, the floor is yours. And thank you very much for gracing us with your presence.
Thank you, Dr. Mkonazi and colleagues online. My name is Taelo Monareng, as introduced by Dr. Mkonazi. I'll be presenting on occupational health and safety within the mining industry. Next slide, please, Doctor. The items of discussion will include the definitions, the occupational hazards within the mining industry, the regulatory framework and requirements for mining industry, training and awareness, PPE within the mining, emergency preparedness and response, initiatives, supports, and successes within the mining industry, and the safety stats within the mines, and conclusion thereafter. Next, please. Many would ask, what is occupational health and safety, especially in mining? Um, We all know that the mining industry actually plays a very important role in the South African economy. It helps in community upliftment, skills development, job creation, as well as the GDP growth within South Africa. The mining industry is regulated by the Mine Health and Safety Act 29 of 1996. The occupational health and safety in mining focuses on identifying, monitoring, and controlling hazards in the mines and surrounding communities, aiming for zero harm to people and the environment. We would all agree that previously we would only focus on the mines, and the community was mostly excluded from the occupational health and safety. But at the current moment, the regulation requires that we include the nearby communities that is affected by the mining environment. It involves strict regulatory compliance with the collaboration between the employers, unions, government. I would add the community as well there. And what happens is that before a mine is opened in South Africa, environmental impact assessment, we call them the EIAs, is done to identify any potential hazards and risk and other aspects that can affect the employees and surrounding communities. There's no mine that can open and operate without the EIA process being done. And it requires public participation, whereby if you are staying in the nearby community and you are concerned about a certain issue, you raise it up on the EIA process when they require public participation. We've seen this within ESCOM in Cape Town, whereby the community had a concern in terms of the pollution that was happening and was created by ESCOM, and a decision had to be made there whether to continue with the operation of that particular power station or not. So the same thing happens within the mining industry. When the EIA process is done, the mining license and permit will be applied for and will be granted by we call them now the DMPR, which is the Department of Minerals and Petroleum Regulation, previously known as the DMRE. Next slide, Doctor. The occupational hazards within the mining industry would include the environmental hazards such as water pollution, air emissions, and the physical hazards is the TMM. It means the trackless mobile machinery. We call them the yellow machines, which are the bigger machines that operates in the mines. And then the biological hazards, which is the bacteria, the viruses, and this kind of hazards are quite severe in underground mining, especially if ventilation is poor. Every mine, underground mine, is required by law to appoint a qualified ventilation officer, and there's certain requirements to control those kind of hazards. And then we have chemical hazards such as the fumes, gases. The most common gas that is found within the mining industry is methane. Um, and it can cause fires, health issues, and other aspects. We've got the health hazards, which is example of it will be the exposure to silica dust, noise, and heat. And one of the most challenging hazard within the mining industry currently is the illegal mining. We call them the zamazamas. They mine illegally. They would find a mine operating and they'll just go in there and mine illegally. This has been a challenge in most mines within South Africa, especially in Gauteng province. We've seen even people mining in areas where people stay illegally. Um, and then the occupational hygiene surveys are done to monitor employees' exposure that employees are exposed to, which is the occupational stressors. And the environmental noise monitoring is done on the perimeter of the mines to ensure noise produced by the mine does not affect the neighboring community. If it exceeds the limit, the legal limit, it means that the mind needs to go back to the drawing board and have means of reducing the noise, things using the hierarchy of control, such as maintaining the machinery that they have, replacing the equipment that is making noise, or yeah, using the hierarchy of control basically. That would even include engineering controls and things like that. And then the different kinds of risk assessment that are done to identify the hazards and risk within the mines would include the health risk assessment that is done by the health team. The OMP or the occupational medical doctor would form part of that risk assessment or lead it. And then we have the baseline risk assessment, which is the umbrella risk assessment done in every workplace, whether it's a mine or any other workplace, it's done to identify the risk and hazards within the workplace. And then we've got the issue-based risk assessment as well that is done. It goes together with the standard operating procedures. And then we've got the daily risk assessment that is done to identify hazards that are present on that particular day and have method of controlling or mitigating the hazards. Next slide, Doctor. And then we've got training and awareness. Training, awareness, and education plays an important role in ensuring the safety of employees, contractors, and visitors. The different training that is done at the mine would include the following: the health and safety training, which includes the internal and external. The external obviously would have to be accredited by the Mine Qualification Authority. And then the mine safety training, which includes the induction and the emergency preparedness. You know that in the mine, you cannot visit without going through induction training and even medical if necessary, depending on which area you go into. And we've got environmental awareness training, and then we've got the daily training, which is done through the toolbox talks and the green area meetings. And then we've got the community engagement as well, where we would have the quarterly meetings with the community just to check if there's anything that they're concerned about. And the PPE in mining would include the hard hats, the eye protection, the hearing protection, respiratory devices, and self-contained self-rescue equipment, hand protection, protective clothing, high visibility vest and clothing, life jackets and belt, safety belt and lines, protective footwear, flashlights and headlamps, which is mandatory for underground operations, and the first aid material. There can be additional PPE that is required depending on the type of work that somebody does, whether it's an open cast or an underground. And then the emergency preparedness and response in the mining sector is crucial for ensuring the safety of miners and minimizing the impact of emergencies. The key aspect would include the emergency response plan, which should include the emergency map with evacuation points identified and marked, the emergency or simulation drills and training that needs to be done on a yearly basis, the availability of emergency equipment or specialized equipment, such as the breathing apparatus and the gas detectors, especially in areas where there can be gas. They call the Madala, some areas they call the Madala side, so there can be gas in those areas. So if you send somebody to go work in that area or inspect something in that area, they need to make sure that they have gas detectors with them. And then the updated risk assessment, which enables the mine to identify the potential risk and mitigation factors. The monitoring program, which includes the regular inspection of equipment to ensure no defective equipment is issued to an employee. You can imagine somebody's underground and they've been issued with a defective equipment to use and it fails, then would have that particular employee will have complications and problems. Um, the initiatives and support within the mining industry, we've got the SAMI, which is the South African Mining Industry, as a base, and then we've got the Mine Health and Safety Council, the Minerals Council, the DMPR, which is the Department of Minerals and Energy. We've got the ASPASA. Most mines are affiliated to, and then we have women in mining. Um, in each province. And then we've got the mining tripartite forums. If you are in Gauteng, you'd know about Ukozi if you're working within the mining industry and the Merafong. There are other tripartite forums in other provinces. And you get the mining industry occupational safety and health, which is called the MOSH. They normally deals with traffic management leading practices. Reason why this was established was because of the higher fatalities that we had that was caused by failure in traffic management, trackless mobile equipment, and other issues. So this was established. And then we've got collaboration with CSIR, which is the Center for Research. Since they started collaborating with all these different um, entities, there's a reduction in terms of the fatalities within the mining industry. We'll see on the next slides coming. And then we've got the social and labor plan. Sorry. Yeah, we've got the social and labor plan, which helps actually in developing the community, transformation, and yeah, achieving the mining plan. This is the safety stats within the South African mining industry. Um, I've put a gap in between so that we can see how far or where we come from. Way back from 2003, we had 270 people that died within the mining industry. And then
Yo.
in 2012, we had Samantha, I think you are speaking. Um, we had 270 people who died within the mining in 2003. In 2012, we had 112. In 2020, we had 60. You can see a decline now in terms of the number of fatalities happening. And then 2021, post-COVID, we had 74. And then 2022, we had quite a decline, which was 49. The biggest contributing factor being the transportation and machinery within the mining industry. So the machinery differs in terms of what it is. You get winches, you get the RBE, which is an equipment that is used to transport material from underground to the surface area. And then we've got the trunkless mobile machinery, which is the yellow machines, and we've got electricity on the other side. Next slide, Doctor. Sorry, there's another one. I think we missed it. Um, there's another slide. I'll just check it out on my.
Yes, you can just narrate it. I think I might have missed it. Maybe I had the
Yeah, I
wrong
just
presentation.
yeah, it's fine. I'll just open it from my spreadsheet here.
Okay.
The the biggest contributor in terms of the fatalities within the mining industry is the gold mining, and the province that has the highest fatalities in is Gauteng province, followed by Free State, and the third one being Rustenburg. Um, Gold being the leading at the moment. Last year we were sitting at a total of total fatalities that we had in 2025 is 7 fatalities, and then we had injuries sitting at 113. So there was no change there in terms of improvement because the previous year it was less than that. And then in 2026, so far, we have total number of incidents that were reported is three. Sorry, total number of fatalities that were reported is three so far. And the province that contributed the most, it's still Gauteng, and yeah, it's still Gauteng province followed by Rustenburg. So though there's progress, we shouldn't have anybody dying within the workplace. We can say there's progress, but up until that particular person becomes your family member, you won't feel that pain. You'd feel there's an improvement until something happens to yourself or to one of your colleagues or family member. You feel the pain even more. Next slide, doctor. In conclusion, the mining industry, though it plays an important role in South African economy, it is important that employees and communities are protected. The current legislation, the support forums, plays an important role in ensuring zero harm to people and the environment. And there is currently a significant improvement in the reduction of fatalities within the mining industry, since you've seen that we've moved now from 270 to 49, and then last year we had seven fatalities. When you compare it, the number seven to 270 that we had previously. It used to be worse, but we seem to be having progress within the mining industry. And it's through the development of different structures and collaboration with different stakeholders. The DMRE or the DMPR and Mining Health Safety Council plays a vital role in ensuring compliance within the mining industry as they do regular inspections. If a mine doesn't comply, there's a Section 54 that will be issued by DMR. If they identify anything that has a potential to cause danger to personnel or the environment, resulting in a temporary closure of the mine until the issue is resolved. And this helps in ensuring compliance because if they know that a Section 54 will be issued, they take matters of safety and environment and occupational health very seriously. The mining collaboration with stakeholders has helped in reducing the number of fatalities within the mining industry. We should not only aim for zero harm, we need to work together at achieving it. There's no mining worker who deserves to die at work. Thank you.
Thank you very much, Austelo, for quite an insightful presentation. At this moment, it doesn't look like we have questions, but while we wait for them, may I please ask you to stay so that we can have that Q&A session at the end?
Yeah.
All right. I'm going to stop sharing this. Okay, just a second, colleagues. Okay, let's share that. All right. On that note, colleagues, please allow me to welcome Dr. Fezile Gabela, who is a medical doctor with a strong interest in occupational health, healthcare funding, and leadership. She obtained her medical degree from Stellenbosch University and a diploma in occupational health from University of Witwatersrand. Later on, completing a postgraduate diploma in management at Northwest University. She has experience in advising medical schemes including serving on ex gratia committees for Sisonke Medical Aid and WCAMCMAS. Her passion for the mining sector is reflected in her leadership role as the Secretary General of the DMPR Occupational Medicine Subcommittee and her membership in the Free State Noise Working Group under Minerals Council of South Africa. She is part of the Executive Committee for Mine Medical Professionals Association, MMPA, and she's known for her collaborative approach. Dr. Gabela enjoys connecting people, sharing knowledge, and contributing to meaningful transformation within the occupational health and mining environments. Doc, are you here?
I am here. Thank you very much, Doc.
Are you ready to share your knowledge? Will you be able to share on your side?
Oh, can you share, Doc?
Okay, Doc. Let me do
Thank
that.
you. Thank
Just a second then. I'm just looking for your slides, Doc. Okay, I have them. Okay, please let me know once you see them. Do you see the slides, Doc? Something?
Yes, I can see. Can you just in presentation mode, Doc?
Are we in presentation mode now?
Okay, I'm not sure if the other colleagues can see it in presentation mode. I was just
Okay, let me try that again.
okay.
Share. Let's share the application. Okay, do you see it?
Yes, I can see it. Okay. I'm not sure why it's not on presentation mode, but it's fine, Doc. I'll
No, let me
continue.
share. Let me share a different screen then.
Oh, okay.
Yes, should be up now.
Perfect. Thank you
All
so
right.
much. All
Thank you,
right.
Doc.
Thank
Go
you so
ahead.
much. Okay, thanks, Doc. Thank you so much, colleagues. This is really great. Our styler, thank you. I think you forgot to add, please don't quote me on this, that coffee should be part of our PPE. Because, yes, it's quite hectic on the mine, but we love it regardless. So, I'm going to be speaking about the role of the OMP on a mine and also just the health aspect as well. So this is just me underground. This is just wanting to show you guys um, behind me, that's a winch driver, and he's basically using a winch. So that is how it looks like. And these are stopes. So if you ever wonder about square, you hear people saying that this is actually what it looks like when these employees work underground. So what is an OMP? Basically, they're strategic risk managers. So you're not just a clinician. You basically need to have foreknowledge of cumulative exposures, as what our Dialo said, and the health implications on it. So you need to prevent these hazards from leading to disease, and you give recommendations when employees are overexposed to these hazards. As an OMP or an OHNP, you also analyze trends and you also look at the absenteeism management and you give recommendations for it. So you basically need to understand the environment, you need to understand the hazards, the linkages, and then from there, know how to manage the risk. So an OMP is a legal appointee as per Chapter 13 of the Mine Health and Safety Act. So we'll go through that. Um, the workplace assessment, I'll also show you that. The surveillance program, the reporting, the IOD management, the compliance. And then we're also going to go through clinical cases with approaches. And Yes, you guys will also be on the spot just to see how you would approach the different cases. Thanks, Doc. So let's get into it. The Mine Health and Safety Act. So from a health perspective, these are the sections that are relevant to the OMP. You do need to know the entire chapters just to know what they deal with. But of importance is Section 11, where you need to investigate every health incident or injury on duty. There's the occupational hygiene measurements for Chapter 12. Chapter 13 is what regulates medical surveillance, and that's relevant to the OMP. And then the record of hazardous work. You also, so on whenever you work at a mine, you do get a report before you exit the mine that shows what you are exposed to. You also need to have a record of your medical surveillance, and the annual medical reports is Chapter 16. Chapter 17 is your exit certificate, and Chapter 19 and 20 essentially also form part of that. I will share this so that you guys, those who aren't in the mining space, are able to understand the Mine Health and Safety Act. So as an OMP, one of the most important things from an OMP, OHNP is you need to understand the workplace. You need to know your area of jurisdiction. You need to know your appointment. Where does it fall under the mining license rights? Is it a surface or underground mine? The minerals that are extracted, so the main ones and any additional ones. And then obviously the mineral extraction, processing, smelting, and refinement. So if you look at the top left corner, that would be sort of like an open cast mine. So open cast meaning that it's open and you basically extracting your mineral. Whereas for underground, you can see there's a head shaft where it says head frame, and that's where you're basically mining underground with the different tunnels that go into it. And then the bottom is basically, for this particular mine, the OMP's jurisdiction falls within that region. Thanks, Doc. So let's get into medical surveillance as per Chapter 13. So medical surveillance is basically a risk-based program for the mine hazards. So for employees who are exposed to dust, noise, chemicals, you need to have a surveillance program in order to be able to limit or prevent health hazards, health events. So the surveillance program is linked to exposures, and you find this in the Mine Health and Safety Act, Chapter 12, Section 3, and it forms part of the frequency of the medical surveillance. So for example, if an employee is exposed to equipment that emits 106 decibels, instead of an annual audiogram, they would then have to do 6 monthly, just to make sure that they don't lose their hearing. And then the Mine Health and Safety Act, Section 13, stipulates that a baseline, periodic, and exit medical are mandatory. So sometimes you do find employees moving between mines who don't have their exit certificates. So the law mandates that these need to be done. Thanks, Doc. So what's the role then of an OMP from a reporting perspective? So one is DMPR. There's annual medical reports that need to go out. Ours was actually due on the 28th. So a lot of OMPs who are in the mining space, yeah, they are quite frazzled this week in terms of getting that done. And then there's Masoyiso quarterly milestone reports. So the industry realized that there was so much focus on injuries. And there wasn't that much focus on diseases. And so there was a collaboration that where the mining stakeholders came together and they started having different milestones for themselves to ensure that no new employee comes onto the mine and basically develops an occupational disease. So I think it's 5 or 10 years, the OMPs who are in the mining space will correct me. This gets reviewed and then we see our progress. So every 3 months, OMPs of different mines have to report on their milestones. So you have to report, has somebody lost hearing? Is there noise-induced hearing loss? How many cases of TB, silicosis, etc. do you have within that quarter? Then there's submission to the Medical Bureau of Occupational Disease. This is mandated under the Occupational Disease Mine Works Act, or DIMWA, where you basically get to see the lung diseases that are up for compensation for these employees. And this is the industry's way of a form of justice, that you were injured, you developed a disease whilst you're at work, whilst you're exposed, and there's a form of compensation. So there is grading. You do find this in a DIMWA, where you can basically see how much these employees would be compensated for. We try very hard not to reach that. So there's a strong focus on occupational hygiene and engineering controls at the moment to ensure that employees are not overexposed. The next bit of legislature is COIDA, where if an employee is injured, Dr. Mkhwanazi spoke about the work-related upper limb diseases, so it falls here. So there's some diseases that are not under DIMWA, but you find them under COIDA. It's very important as an occupational health nurse or OMP to know which insurance basically pays for these diseases, so that employees are then compensated accordingly. So I put a couple of them here, but there is a comprehensive list under the COIDA Act. And then obviously the DMPR health incident reports. So if there's an occupational disease such as silicosis, TB, you would then have to report this to the DMPR, and you'd have to state what the disease is, and then you submit that. Then operationally, you need to give trains. It's important that in as much as production is prioritized, but it's important that the operation understands the value of the health team. We ensure that employees engage safely and productively to ensure sustainable production. So when you don't produce these trains to management to tell them that, listen, some of your employees are fatigued, let us assist and see how we can mitigate against this. Or noticing a lot of employees who are coming with flu symptoms, how can we mitigate against this? So you are forever mitigating risk. It's not static, like what Alstailer said. You are continuously looking for issues and you're strengthening your operation. Thanks, Doc. Then there's IOD management. So it's important as well as a health team to manage injuries on duty. So triaging, treating, referring, and most importantly, following up on these employees. And you classify the injuries. So the mining industry has a specific way of reporting and classifying injuries. So we have reportable injuries and recordable cases. So reportable meaning we then send it off to the regulator, and recordable is for our stats, where we can see how can we actually improve on our cases. So these would be lost time injury, medical treatment case, first aid. In the gold sector, interestingly, they have a different way of doing things. So I'm speaking more from a call perspective. And then you do need to conduct a section 11.5 as mandated by the Mine Health and Safety Act, and obviously rehabilitate your employee if they need rehabilitation. And then most importantly, because you understand the occupational space, you need to make sure that this employee is able to engage in their work after the injury. So a lot of times you find that GPs or treating specialists, if somebody had a fracture, they'll say, oh, the person is fit to work. But if this person is going underground and has to walk for about 4 kilometers, and they were discharged, there hasn't been that much rehabilitation. Even though they may be fit to do light duty, they're not fit to go underground. So you need to ensure that your rehabilitation is in place. And then obviously for those who can't engage, then there's an incapacity process as mandated by the mandatory COP on incapacity, where you adapt the tasks, modify, and we really try by all means not to terminate these employees. So from a compliance perspective, I won't go through each and every one, But essentially, this is what governs the, the health space. These are the different guidance notes. They are available on the DMPR space if you're interested, on the mandatory codes of practice. Thanks, Doc. Okay, so this is just me sharing some of the work. So I have a background in the gold sector, and now I'm in the coal sector. So it's very interesting. I wanted to show you guys some of the things we deal with. So if you look at the middle picture, that is a confined space for us. So there's that black hole that you can see, that would be confined space. We need somebody to essentially fit into that. So BMI is very important component for us. And then to your left, that is a winch. This is now in the gold sector. So this would be what a winch would look like. So quite a number of employees lose their hands when their fingers get stuck in between these ropes. So it's important to know what that looks like. And then obviously in the coal sector, these are the different machines. Our stylo spoke about the yellow machines. They're very massive. You'll see a picture of them. And you need to ensure that employees are not fatigued, because fatalities are, they can happen if somebody's fatigued. It's very devastating. So I'll share this case and the approach I had, and then we'll do one and hopefully have people volunteering. Remember, there isn't really a wrong way of doing things. It's how you can back up your logic in terms of the clinical evidence, in terms of the mandatory codes of practice that govern your space, so that you work within that scope. All right. So we can start with the first case that I'll tell you guys about. So this is the big yellow machine. If you look, there's a lady there climbing up the stairs to this machine. Dr. Mkhwanazi, I'm not sure if you, yes, there's the lady. So you can imagine these machines are massive, and that if somebody has a cardiac condition, epilepsy, and they fit, it's devastating for them to fall. So we are continuously managing risk, and you need to understand your workplace. So it was a 55-year-old female who operates an ADT. This is an ADT, and she was admitted for chest pain. Her ECG initially had a 3rd-degree AV block. Her echo, the ejection fraction was 40, and she was managed with a pacemaker, which was under the skin, and she was also given Alzam, and this was also included as part of her management. The cardiologist felt that she can engage in her duties fit for light duties, and now she came back expectant to work. So how does one approach this from an occupational medicine space? So you need to know the work-related exposure profile of this employee. So are they a shift worker? Do they work in confined spaces? Like I said, the height, so in the coal sector, a height is equivalent to more than 2 meters. And are they a passenger or non-passenger driving? This is very important for you to first determine this person's fitness to work. Then it's the occupational risk exposure profile. Do they work underground or on surface? So she's a surface employee. So this lady works shifts. She is also a driver. She's an operator, and she was working on surface. Then you need to know what hazards are these people are exposed to. So those are the hazards that our stylo spoke about. So I won't go through all of them, but for her, which was very important for me, was the whole body vibration. She had a pacemaker under her skin, and I was just concerned that it would dislodge with the vibration. Then you need to know what are the tasks that she has to do within this role. So HR would then provide this, and I understand what her day-to-day would look like. Then the treating specialist recommendations, you also consider that. So the treating specialist, as you can see, I put a smiley face because you see this a lot as an OMP. They said for light duty, and the employees are so excited to go back to work, and you just have to be that person who says no let's wait a bit and really look at your condition in totality. And very importantly, and I think this is a part that sometimes we forget, is the employee autonomy. This, I've highlighted it, is very important. How do you feel? We really do need to ask employees how they feel about their condition and support them from their level. So you have to have that as part of your approach where you ask the employee, can you handle the workload? So the aim is always to be less patriarchal, obviously keeping safety in mind as a huge priority. And then you would send these employees for functional capacity evaluation. RFA is another name where there's an occupational therapist who basically assesses these employees and they are able to give you a job guideline to help you determine placement. And then you can also do a workplace assessment because you can imagine if you are sitting in your office as an OMP and this lady comes and says, I operate a yellow machine. You're not going to have a concept of what that is until you actually go and appreciate what they actually do. Then you assess the causality. So you always try and see, is there a link between this condition with the occupational space? Is it an occupational disease or not? And then obviously looking at the DMPR minimum standards to work on the mine. This also governs us, the company policies, and then you get to your OMP decision. So it's quite a lot. You don't just make a decision immediately. It's quite a lot of steps to go through. So in your recommendations, always aim to align with the MCOP on incapacity. Don't try to reinvent the wheel. Remember to tell employees of their right to appeal. That is a Section 20 as part of the Mine Health and Safety Act. So with this lady, she was not able to go back to her job. There were concerns from a health perspective. She's in a safety critical role. So she was then subsequently placed in a different occupation where she wouldn't be exposed to vibration and should be in a safer place. So I'll be putting the spotlight on you guys where we look at the next case. Thanks, Doc. So the next case, it's a pre-employment. It was a 32-year-old male rock engineer working underground. He was using insulin, Rhizodec, 10 units at night. He works on site 3 times per week for 4-hour duration. And this was his HbA1c, it was 10.2. His HGT was 6. Clinically stable, no glucosuria. And the company has a standard that doesn't permit for insulin-dependent diabetes mellitus to work underground at all, as he's in a safety critical position. So let's discuss. So this is essentially for an underground coal mine. This is a machine. It's called a coal cutter. So the coal mine is different to gold mines in that gold mines, you go deeper, whereas with coal mines, it's a bit more wider. The ventilation is a little bit more. So this is a case, and I'll just be putting the spotlight on you guys. What do you think? How would you approach this?
Colleagues, you may raise your hands or maybe post in the chat room. I'll be monitoring it. Go.
Okay, I'll share the other one as well whilst they think about this one, Doc. The third case, it's a 36-year-old male. He had an injury on duty. The crane capsized. So this whole, the crane essentially fell on him and he had amputation of the right 2 middle fingers, his right hand dominant. So this was at the distal level, so right at the bottom. That's where the amputation happened. He's a crane operator on surface. How would you approach this in terms of your fitness to work approach? And those are the 2 cases.
I can confirm, Doc, that there's nothing yet.
All right.
I think we're
So
going to
I
have to
think
rely on your wisdom on this one.
no problem. So I'll go to the second case. No, guys are a bit shy. So I'll go to the second case. So this employee, oh, Doc, we could go to this. Is it case two? I'm still stuck on case three. All right. So basically with this case, it was an interesting one because this is somebody who, I mean, this is what they've studied, being a rock engineer. So from a psychosocial perspective, I mean, a fitness decision is very crucial for them, and being made permanently unfit is devastating. So as an OMP, you're always stuck between the emotions of everything, whilst you also have to look at the policies and the legalities surrounding your decision. So the company had a very strict standard to say any employee, regardless of their insight into the condition, they absolutely cannot work underground. And you always have to remember your evacuation plan. How fast would paramedics get to this employee underground? Um, how would they be able to stabilize this employee as quickly as possible? So those are all the things that you have to think about before you engage somebody who has a chronic condition that may deteriorate underground. So it's also important to know the mechanism of action of the insulin because you need to know the half-life, you need to know do they get drowsy, all of that. It's very important. And also obviously the times. How often is he going underground? Is he going with people? Is he going to be alone? Is there food allowed underground? So you have to factor all of those in. So with this employee, unfortunately, he was made permanently unfit um, based on the company policy, based on the minimum standards of fitness. And Section 20 was, he lodged a Section 20 appeal, and he was then able to work underground based on the strict monitoring that we then had to ensure that he has. And yeah, he's in a much better place and he's back doing that job as a rock engineer. If there's any questions, you let me know and I'm happy to engage. Then with the third case, this was quite a devastating case. This employee basically lost two middle fingers. So I don't know if you can even picture for yourself or even try to bend your two middle fingers. Already your function is sort of, it starts getting affected, right? And it's very easy to then assume that it's completely life-changing, as in they might not be able to work again in this position. But like I said, the gold standard as an OMP and OHNP is always to go on site. Guys, it's the gold standard. Because if you assume in your office that this person will not be able to engage in their work again, then that's a livelihood cut off. So this employee actually was rehabilitated extensively. There was a lot of assistance around him, and there was a lot of OT, hand therapy, and I'm happy to say he's actually back operating a crane with no PTSD as well because of the level of rehabilitation and support he got from the employer. So my parting shot is as an OMP, you're always going to find yourself. Oh, there's actually one last case. This is an important case, and I think, Dr. Mkwanazi was speaking about work-related upper limb diseases. We always forget about this employee, and this employee is also some of us. Some of us are this employee. So um, this was a lady, 41-year-old HR specialist, who presented with right hand weakness, pain, and limited functionality of the hand. So she was diagnosed with carpal tunnel syndrome with muscle wasting secondary to nerve atrophy. So that means that the nerve was completely, I mean, the nerve was not functional. And so she started having a lot of weakness in that hand. So she was incapacitated and the hand function was markedly reduced. She couldn't even pick up a cup. So what's important to remember about these employees? We always focus on, the employees in safety critical roles, but we forget about the office workers. These people are also exposed to risk. And ergonomics is a part of your risk assessment. We always forget about it, but it's a huge component as well. And you need to monitor underlying medical conditions. So ensure that for those with rheumatoid arthritis, SLE, that you just give a bit more education around joint protection strategies. And work-related upper limb diseases are always forgotten. So please, COIDA does compensate these employees. Please do justice for those who are affected. So my parting shot is, as an OMP, you are always going to find yourself in a triad. So you'll find yourself between the regulator, the employee, and the employer. Always, always, always. This is something Dr. Tsepo Sidibe shared. Try to find yourself in the middle. Because if you side too much with organized labor, the employer will be very upset with you. If you side yourself with the employer, the employees will be very upset with you. So as an OMP, you always need to play a balancing game. And also just remember that these are people's lives, and essentially you're working together collaboratively in collaboration with the entire mine. So try not to exclude yourself, but be part of the life of the mine to ensure that zero harm is achieved and you're part of that process as well. So thank you so much. I'll wait for questions. Thanks, Doc.
Doc, thank you very much. Colleagues, I'm aware we are a little bit over our time. It's 7:10. So I'm wondering if you'd allow me or allow us to at least go through a few questions if you have. Do you have questions, colleagues? I see one from Progress Ditsele. Yes, please go ahead, Progress.
Yeah, thanks, Dr. Mkonasi, for arranging this talk today. It has been interesting take homes from both speakers. Just a quick one from my side. I would like us not, lest we forget, just to remember and pay tribute to the employees and the families of the Ekapa mine in Kimberley. Noting also the cowardly act by management to quickly rush into applying for liquidation when we still on a recovery process. And coming to the topics itself, I think Dr. Gabela raised something that is very important in terms of us as OMPs. And I think the incidents as we see them, like your Ikapas and your lily mines and all that, we as OMPs have got a role to play there. And I think very importantly is to always make sure that we teach our employees about their rights. And one of those is their rights to appeal, and which is 20 section, and the section 20s on your CCMAs and your section 22s in terms of making sure that their health and they are responsible for their health, and section 23s in terms of making sure that they always withdraw from any situation that they deem as risky. And coming to the cases of Dr. Gadela, case number 2, quickly. I had a similar case this week. And, same thing, pre-employment, and somebody who's diagnosed with insulin dependent. And when I went through it reminded me of my previous employer where I was running medical incapacity there. So I'm sure that the reason why he won the Section 20 appeal was because of there are alternatives now that can be used or that can be better better used to monitor your blood glucose levels. So the fortunate part about the employee that I had was that he was on this machine, which he puts on the skin. There's various types. Dexcom is also one of them, which is one of the top-rated machines. So his machine is quite interesting. It measures the blood glucose. It puts it on his biceps, measures glucose every hour, alerts him of any deviation. He can put in up to 20 people on the, it's connected to his phone as a smart app, on a smart app. And it alerts him of every deviation in terms of the glucose, whether it's high or low. He can put in up to 20 people on the list of people who will be also notified. And in his he's previously employed in another mine where he was working on surface, but now he was applying for a job with one of our side to go underground. And he has a supervisor on there. He's got his foreman there. He's got his parents. He's got his doctor, and all of them can be alerted when there's a deviation in terms of the blood glucose. He's on insulin. He uses it in the morning, and which is before he comes to work. He's not on shifts, and he also uses another one at night. So, in terms of the mitigation, I had all the tools in front of me to not declare him unfit. And that's exactly the route that I took because of past experience also. So, and I'm just saying, let's be aware of all the new developments that are there. Let's acclimatize ourselves with some of these things because sometimes we will make a decision which, when under Section 20 appeal, then it gets overturned. So sometimes it's not necessary. And I kept quiet deliberately because I wanted to hear other colleagues' experience in terms of their workplaces. So on the last case that you talked about in terms of office workers, that is very important. And the basic thing and simple thing about that case is that it's an occupational disease which has to be reported for compensation. Thank you.
Thank you very much, Doc, and that was quite insightful. I see there are still no questions. I see there is a comment here. Colleagues, we are about to go. I'm aware that we are well over our time, but I think the topic is just too interesting because here at OHESA we never really tackle mining. But guess what? This is the first one of many ones to come. The machine that doctor is talking about is called insulin pump with a sensor continuously monitoring the glycemic level, used mostly by diabetes mellitus type 1. That is Dr. Regina Monaching from Rustenburg. Austelo, if you are still here, I just wanted to ask you to clarify one thing. You spoke about the TMM, and I think in our normal industrial occupational health, we talk about driven machinery. So, what would you say is the difference between TMM, trackless mobile machinery, and our moving machinery? Are you there? Okay, please unmute
The
yourself.
TMMs normally, sorry, I was
Yes.
muted. The TMMs normally, the trackless mobile machinery, it's normally the yellow machines, the bigger machines, and the driven machinery can be anything that is used to transport anything. It can even include a lift that is used
Mm.
by employees. So that is actually the difference. It can include the winches, the RBE, and other stuff. Those are driven machinery. Whereas the other one, the TMM, it's in particular the yellow machines, those mobile machines that are driven by people. Yeah, not sure if that is clear.
Yes, Austelo, thank you very much. So here we are not talking about forklifts, which may also be classified as driven machinery or moving machinery. We are talking about trackless mobile machinery, colleagues. And I know some of you have just developed a keen interest in mining environment. So it is very important to know and understand this. And Dr. Kabela, as you close, what is the impact of these zamazamas in the safety of mines that are still operational? I'm asking because I've heard that there are certain mines that are shared between zamazamas and ordinary official employees of the mine. What are the potential hazards that you can think of? I know I'm putting you on the corner here.
Yeah, no, yeah, it's a very important question because you do hear these accounts. So from a psychosocial perspective, I mean, psychologically, you can imagine sometimes the zamazamas are right there. I've had accounts of employees saying that. And you just have to keep working as if you don't see them. And then they tell me that they evacuate and they continue, So you literally have somebody looking at you, whilst you're working and you have to keep quiet. So the intimidation that goes with it. So the psychological impact is quite huge for some of these miners who work alongside some of these zamazamas.
And these zamazamas sometimes carry quite heavy guns, eh?
Yes,
Yeah,
yes,
yeah.
I can
definitely.
imagine working alongside somebody with a big gun.
Yo, it's quite
Mm.
scary. It's,
Can I add on that as
Yes,
well?
please.
Within the women in mining, they've complained that the Zamazamas would actually follow them to their houses. They give them a list of what to bring underground, and if they don't, they threaten the whole family. And some women got raped underground by the Zamazamas. So it's quite intense at the moment. I think that's one of the reasons why our president mentioned that they're going to deal with it through what is it?
Military
Yeah,
intervention, I think.
yes, through enforcement of additional forces.
Hmm.
Unfortunately, it is like that, especially in bigger mines. The gold mines, especially, they experience that quite a lot.
Sure. All right, colleagues, we have come to the end of our session. Austyle, your final words, followed by Dr. Kabela.
Thank you, colleagues, for this session, and Dr. Mkwanaze and Dr. Fezile. Um, if there's any information that anybody needs, I think we can post it to Dr. Mkwanaze so that we can maybe answer in the near future if you do come across anything that you want to know. So we are available to assist. Thank you.
Thank you. Dr. Fezile.
all right. Thank you so much, Dr. Mkwanazi. Thank you, Ausdaelo, and the whole, the colleagues. Like I said, this is a learning platform. I enjoy learning and sharing knowledge, and I'm so happy that I was able to do that. And we forever growing, right? And in us growing, we are ensuring that our employees and the people that are in within our care are always looked after, and the due diligence needs to be done in all our part. So you are never a hero. You're never on your own in the mining space. You always work as a team. So thank you so much for this opportunity.
Thank you very much, Doctor, and thank you very much, Austyle. Please avail yourself again in the future whenever we need you. And as for colleagues, if you have questions that you were not able to ask, remember we have a WhatsApp group, OMP for all. The group exists specifically for the purpose of enriching each other with knowledge and information. Sometimes we even share jobs. On that note, colleagues, let's meet again next time on Saturday. Details will be shared in the group. Thank you.
Thanks, bye.